Hello guys, welcome back again to my channel. This is an official live video. I honestly don't know if anyone can hear me. Can you hear me? Okay. Feel free to use the chat box to communicate your concerns. It's quite hot over here, that's why I'm okay. Hello, good afternoon. Can you hear me? Hello guys, welcome back again to my live. Feel free to send in your questions using the chat box. It's currently 4:24. I was supposed to have started this live quite earlier, but I've been quite busy. Okay, yes, we can hear you. Thank you so much, Adams Paul KS9YD. Yeah, thank you so much for commenting. So if you have any questions, and this live actually is what I plan on doing more often, going live so as to communicate with my community, because it's looking like you guys only see me when I post videos and all of that. So yeah, I'm here to answer all your questions. What do you want to talk about? You can leave it in the chat box, then I would pick up from there. Yeah, so I'm waiting for your questions. You can type it in the chat box. Like I said, going forward I will do more lives. To be honest, I will be doing more lives. It's quite hot over here. That's okay. Going forward, I'll be doing more lives. Some of these lives will be silent lives. It's going to be like study with me kind type live. Cause watch hours is something that I know that I've struggled with and my channel has struggled with, and from what I've seen, honestly, the easiest way to get this watch hour is actually to do live videos. So yeah, I'll be doing that. Maybe that those will be most likely at night, right? Then during my daytime, if I'm going to do any daytime live, it's going to be okay. It's going to be if I'm going to be doing daytime live, it's going to be proper communication with you guys. But maybe if I'm going to be doing night live, it's most likely going to be like night silent live streams. I really hope that you all can hear me. So Adams Paul KS9YD says, please, how do you deal with failure in medical school? To be honest, failing, I know like one particular time that was very significant with failing was in my first hematology. Yeah, it was my first hematology test. I know that was a test that I think I got 34 over 100, which is major failure, right? And for me, I've come to the understanding that actually failure is actually part of the learning process. Because looking back now, I most of the time say that okay, maybe if I didn't fail that first test, maybe I wouldn't have. I know myself, I'll always take things seriously, right? But like failing that first test was more like additional push to take my time out and to study this course and to study it properly. Adams, can you hear me? So I feel like you have to adjust your mindset, right? I understand that this for most people is not considered as major failure, but like I see failure as an opportunity. Once I see like there's a window for me to be able to do better and for me to be able to attempt this again, right? I just see it as a reminder like I'm not perfect, like I don't know everything. So like failing is like a reminder that you can do better, and basically this is not just the end. Maybe you didn't, and also I face my like I said, I've developed a positive. Although I know like I used to disturb myself back then. I want to reach out to senior colleagues and I'll be complaining and all of that, right? I still do that sometimes, right? Because I feel like one way to, get rid of that feeling is to speak to somebody about it, right? But at the same time, I've also come into the understanding that okay, it is all part of the learning process. I used to have a friend that will tell you that failure is not the end of the world. Like it isn't. It is not the end of the world. I know at that moment it will feel like definitely this is the end of the world. But like people are going through a whole lot though. Like if you sit down and think about the problems of the world, you realize that your problem is not even up to 1% of the major problems that people are facing, right? There are people that are losing their parents, there are people that are going through major life crisis, right? So if you think about it from that aspect, you know that oh, your failure is just like a fraction, right, of that. But that is not to invalidate your feeling, right? So please keep sending in your questions in the chat box and I would respond to it. So I'm currently responding to Adams Paul KS9YD. How do you deal with failure in medical school? So for me, right, is first off I would sit with it. Because I think most people what they try to do is try and like shift away their focus. But because you are shifting away your focus, it does not necessarily mean it will go away. That is just the truth. So you just have to be able to like face it, acknowledge that first off, okay, yes, I feel this thing. Okay, and that is not going away. So now what were the reasons why I feel this thing, right? Because your failure can be useful, like you can pick up lessons from there. Okay, is it that I didn't study properly for this? Is it that I didn't just use the right material? Like what exactly was the reason why? So basically I try and answer these questions. I call it a retrospective study. So if most people reach out to me and tell me okay, I failed this thing, most of my junior colleagues like reaching out and asking me okay, I failed this time or have done this, the follow-up question is have you sat down to do a retrospective study? Have you like look at it, like what were the reasons why you fail? Like were they things that could have been avoided? Are they things that can be changed? Like and how has this whole thing affected you? But like once you sit down and answer those questions, like okay, this is the reason why and this is what I can do next time in order as to change this, then from there you avert or you prevent such failure from reoccurring, right, by implementing this. So, like I said, if you see failure as part of life and the fact that it's not meant to hinder you, please make sure to like. You can like. I think you can like and subscribe. Pardon me. You can like and subscribe to the live so that more people can join. I can currently see that like two people, I guess, on this live. Thank you so much. So basically, once you're able to like do that self-assessment and you're able to um okay. Oh, it's not a question. I thought a question was yeah. So once you're able to do the self-assessment thing, where you're able to actually like think about it, like what made you feel and how could you change this, right? Write down how you're feeling, write down your thoughts, write down your plans, and speak to someone about it too, because that's another thing. We think that we are the only ones pain was not only meant for you to deal with, right? So basically, like, speak to someone about it. Be open. Be open. That is one mistake. People think that they can handle everything, but sometimes, yeah, you can, but sometimes you can't. You just have to reach out to someone. You just have to speak to someone about it. So yeah, those are some of the ways. And like I said, do what you love. Like, for me, I've learned not to postpone happiness, because that is another thing, right? Like, I would, sometimes, even before I see results, or even before I do, I will take myself out, like, because I know I have put in the work. Once you know that I've put in the work, right, you don't even have to wait for the result to come out or any of those things. You take yourself out, you basically do the things you love. If you like playing sports, you go out, you play football. If you like, if you just want to eat well, maybe you haven't been eating well, like, you take yourself out. Like, just don't postpone happiness, right? So yeah, I think the first change is actually developing a positive mindset towards failure and understanding that it's not the end of the world. So Adams, I hope I've been able to answer your question, right? So if you have any more question, please type it in the chat box. Thank you all. You can say hello so that I can, shout out your name too, because I would also do that. Okay. Stu. So if you have any more questions, please type it in the chat box and I will definitely respond. Um, I really appreciate each and every one of you for tuning into this live, because to be honest, I don't know. I never really expected a lot of people to be interested in joining the live. But yeah, you guys are here. Okay. Any more questions? If you have questions, basically, maybe if you want more insight, if you want more insight into the life update videos I did, or if you have questions concerning medical school, because going forward, guys, I have quite a lot of videos in store, right? So basically, what good afternoon, thank you for joining. Please feel free to type in your questions in the chat box. Leave your questions in the chat box and I would answer it. Just say hello to me in the chat box so that I can also shout out your name. Thank you. So I kind of have like a kind of backlog of videos, because I know I did film. There was a time I filmed a lot. So what I'm basically doing is editing those content and you know making edits to those content. So that I know that is basically one of the major things that I'm doing currently, right? The videos aren't so much, but they are quite a number. They're quite a couple. Please make sure to type in your questions in the chat box. I would definitely respond to them, and share this live too. Please, let's share the live. Let's share the live. Let's share the live. Okay, can you? Okay, can you? Um. Okay, guys. I don't know. Can you? Hope you can just really hear me. I hope I've been able to answer your questions, so Adams. Hmm? Hope I was able to answer your questions, Adams, as regards dealing with failure. Yeah, thank you so much for joining my live. If you have any questions, please leave it in the chat box associated with live, med school, YouTube, whatever questions that you might have. I would respond to it. Please do make sure to like this live and share it. Thank you. So yeah, I don't know, guys, if you guys are not even Okay. Can you hear me? Okay. Welcome to my live. Please, if you have any questions, leave it in the chat box and I would be sure to answer them. I know I was sent some questions too, but now having to exit this live, I will send some questions. I would also try to respond to it on this live. Hopefully this live videos will be stored. Please, if you have any questions, leave it in the chat box and I would get to them. I know someone did ask me about pharmacology, but a pharmacology video will be coming up um tomorrow. Hopefully tomorrow. It was supposed to go up today, oh, but I don't think I'll be able to. I don't know, honestly. So I think I'll just leave it tomorrow. It's going to be up. But anyway, for tips and tricks with pharmacology. So I know like pharmacology, it's a very content heavy subject and it's filled with rote memorization. Please, if you have any questions, leave it in the comment box below. I will definitely get to it and I would answer the questions. So I do know that, and I really hope that you can hear me, to be honest. So I know that pharmacology is filled with so much memorizing, right? So some of the things that actually worked for me. I know like in the video I did say a lot. I said a lot in that video. Gosh, now when I think about it, because that video was really long. But one of the key things you have to do is to first off understand the prototype drug, right? For every for every um for every system there's a prototype drug. Okay, for example, if you're talking about loop diuretics, like fusamide is one of the prototype drugs there. Then if you're talking about thiazide diuretics, definitely thiazides, right? Or when you're talking about things like antidepressants and you're doing what did you call those drugs? SSRI, selective serotonin reuptake inhibitors. You know, like fluoxetine is like the prototype drug. So basically, in every part of pharmacology, like for beta blockers, there's propranolol, which is the prototype drug. There's always a prototype drug which you would learn first, right? So now for pharmacology, I think if you want to actually write a good pharmacology essay, you have to build your essay on the fundamentals of pharmacology. For a pharmacologist, they would want you to start off with an introduction, they would want you to have pharmacodynamics. Pharmacodynamics refers to more of the drug on body action, and it's usually the mechanism of action that forms pharmacodynamics. So basically, they would want you to write on pharmacodynamics, then which is the mechanism of action. So when it comes to the mechanism of action, um you don't just write you don't just write basic, like if like when I say mechanism of action, they want you to show them that you actually understand the drug. So if you know, like especially for when it comes to steroid drugs, but you have to be talking a lot about signal transduction, right? Because that is how basically lipid drugs work, right? So and if there's anything like G coupling signaling associated with this um drug also, you have to include that, right? But what I'm just trying to say is that um for the pharmacodynamics, right, the mechanism of action, you have to demonstrate that you really understand the mechanism down to the T, down to the basics of basics, right? So you start with, like for example, now if you're talking about anti-diabetic drugs, right, most of their classifications are based on their mechanism of action, right? When we have things like biguanide, sulfonylureas, and we know that sulfonylureas usually it's a potassium channel um opener, right? So it opens the potassium channel and that leaks out, then calcium influx happens, then basically there's a whole mechanism. So you have to understand the step-by-step process, like okay, what happens, which one starts first, and what is the progression like, right? If there's any G protein G coupled signaling, right? Like I think for when you're dealing with beta agonists, they are G stimulatory in action. That's for beta 1 and beta 2, right? So these are like key things they would want you to mention under the pharmacodynamics or the mechanism of action. Then you move on to pharmacokinetics. In pharmacokinetics, what they want you to demonstrate there is that you understand the ADME, which is the absorption, the distribution, the metabolism, and excretion of a drug. Now, most people forget that before you even start talking about absorption, distribution, metabolism, and excretion of the drug, you have to talk about the route in which the drug is given. Because before the drug is being absorbed, it has to be given via a route, right? Whether it is oral, which is whether it is parenteral or non-parenteral, right? So you know parenteral now, it means through the IVs, but basically you're talking about intravenous, you're talking about intramuscular, interperitoneal. Those ones are more parenteral because they are more invasive, right? Then we have the non-parenteral, like the oral route, the inhalational route, the rectal route. So basically they want you to demonstrate that, okay, first off, you know how these drugs can be administered, right? So most drugs, they can be given IM, IV, right? um then intraperitoneal, especially for insulin drug. Insulin is usually given subcutaneously, right? That is one of the major ways it's given. So basically, understanding this, then for most drugs, there's the oral, especially when it comes to oral hypoglycemic drugs. Even in the name itself, oral is there. So you know, like the route of administration is oral. So once you're done demonstrating that, you move on to the absorption of this drug, right? Like so they would want you to explain, like, does it actually undergo first pass metabolism, right? Or it is 100% absorbed, like, especially when you're giving IV drugs, like everything goes straight into the bloodstream, and it's so they want you to demonstrate that you understand this. So if it is an IV drug you're giving, you know that that one 100% absorbed, everything goes straight into the blood. But if you're giving things like oral, now you have to be very particular. Like some oral drugs actually undergo first pass metabolism in the liver where they are being degraded. So welcome to my life. Welcome to my. I know that people are joining and living the life. I don't know whether it's a network problem or what, but like if you have any question, please leave it in the chat box because I'm really excited to answer your questions. So leave the questions in the chat box. So back to what I was saying. They want you to welcome. Please, if you have any question, leave it in the chat box. Thank you for joining my live. Please do like this live. Thumbs up, like the live, and just like the live for me, please. Thank you. And also share the links too. I'm here to answer your questions. So, basically, they want you to demonstrate that you have very good understanding of what this is, right? So, then for the distribution of the drug, how distribute is it well distributed, widely distributed? I think most lipid drugs are usually widely distributed because it can permeate the cell membrane and all of that. So they would want you to also demonstrate that. Then, um, the metabolism of the drug, right? Does it undergo first pass metabolism in the liver? Um, what else again? Basically, is it metabolized by cytochrome P450? That also plays a role, right? Because you know, like if these drugs are metabolized by cytochrome P450, now you'll be more concerned. Like, is it you'll be more concerned when these drugs have been taken with inducers and inhibitors, enzyme inducers and inhibitors. So yeah, those are some of the concerns. Then excretion. Most drugs are renally excreted, right? They're excreted in your urine and all of that, right? So they want you to demonstrate that you understand the paradigm or like the whole structure when it comes to ADME, which is the absorption, distribution, metabolism, and excretion of these drugs. Then after that, they want you to demonstrate if you have idea of the side effects. So I'm currently answering a question I was asked on pharmacology, basically how to go about it. I have a whole video coming up, but like this is a summary video. So after that, what else? They want you to demonstrate the knowledge on side effects and adverse effects. So you know, like side effects are like the expected effects. Okay, thank you so much, Enixar696. Thanks so much for joining my live, Enixar696. I really appreciate your presence here. Please, if you have a question for me, leave it in the chat box and I will definitely get to it. I'll definitely get to it. So back to what I was saying, they want you to demonstrate that as well. Then side effect is like the expected effects, and most drugs have expected effects of nausea, vomiting, headaches. Those are like expected effects, right? Then adverse effects are like things that are not expected, but they happen with these drugs. And most of the time you see it with toxicity of a drug, like indigoxin toxicity, organophosphate poisoning, or atropine poisoning, usually due to overdose. But these are some of the symptoms that you would see being manifest, right? Then, but for me, sometimes I just write the both of them together. But I know that is wrong, because when they ask you for adverse effect, they mean it. They want you to write the adverse effects of the drug. Like, don't. Okay, for another trick is that for sulfur containing drugs, if you're dealing with sulfur containing drugs, one of the major side effects for them is hypersensitivity reaction. That is why most people, I think during the time of penicillin and all of this, I know that was one of the major issue, which was the hypersensitivity reaction. um Usually seen with even all these quinine, all these anti-malaria drugs that used to cause itching back then. That was one of, yeah, that was one of the major issues that they had because of the hypersensitivity reactions and all of that. Anixa, yes sir, the pharmacology tips is very helpful. I'm really hoping that it helps each and every one of you, because like once you understand this backbone, you understand what pharmacologists want. A pharmacologist will not want you to just come and write 2 lines and go. Like, there are key things that they want you to mention. So, what else am I forgetting? So when you're done with side effects and adverse effects, you have to talk about the clinical function of the drug. Therapeutics. I would say clinical function of the drug, right? So basically, if you're writing on TB drugs, it makes sense that the function of that drug will be used in used in treatment of tuberculosis, right? That is the clinical function of the drug. So some people don't write clinical function of the drug because they feel like it's obvious. Obviously, anti-malaria used in treatment of malaria, but you would write it because that is the therapeutic use. Yes, you can put it as therapeutic use of the drug. That is the therapeutic use, even if it's obvious. Antidepressant used in treatment of, you still write it used in treatment of depression. But most of the times, these drugs, right, they have other uses, right? So like when you're dealing with oral hypoglycemic drugs, right, that is your drugs for type 2 diabetes, right? They can also be used in treatment of acromegaly. That is one unique thing with them. They can be used in treatment of acromegaly. Or when you're dealing with beta blockers, propanolol especially, you would say, okay, it's used in treatment of hypertension. But yeah, those are correct. But do you know that propanolol is also used in thyroid treatment, in preventing the peripheral conversion of T3 to T4? That is a therapeutic use, right? Which is not just in tangent with the typical therapeutic use of hypertension and heart condition. Like, I'm bringing up another one. Like, it can also be used in a management of hyperthyroidism, right? um then basically, you have to write down the therapeutic use of these drugs, right? Then after you're done with therapeutic use, I think I think you've covered majority of it. Then you can do your conclusion and all of that. But I think once you write this, and I notice that most times for pharmacology exams, I don't know for other schools, but in my school, they will actually like tell you what they want. They will tell you right on the mechanism of action, adverse effect, pharmacokinetic, pharmacodynamics. Like, they will list out everything that you are to write on, right? So yes, please subscribe. Thank you so much, Tabe Hit 123. Thank you so much. Please subscribe. Please subscribe to this live. Leave your questions down below and I will definitely answer it. I've been answering. Please, thank you so much. I've been answering pharmacology tips, because I know someone requested for pharmacology tips, which is what I'm just trying to go over. And so far, I've said you start with introduction, you start with pharmacodynamics, which is the mechanism of action of the drug. You move to the pharmacokinetic. Under pharmacokinetics, you talk about the absorption, the distribution, the metabolism, the excretion of this drug, which is your ADME. Then you move on to talk about the side effects, the adverse effects, the therapeutic use of the drug. Then I think from here you can talk about concluding. Most of the times they will tell you what to write, right? They'll say write on this of the drug, right? So it's very important. And here another important thing, because I noticed that most question doesn't know this. So like if you're on this live, you're actually lucky because you'll be getting like some extra tips that maybe I didn't mention in my video and all of that. So when you're talking about antibiotic use, when you're talking about antibiotics, a new part of their outline is that you have to talk about antimicrobial. You have to just talk about microbial resistance, like, right? How can and microbial resistance for most drugs are usually for most antibiotics are usually the same. Development of an efflux pump, mutation of genes, rearrangement of binding sites, like those are or change of binding sites. My video is related. You can edit. Okay, Tabe hits. I think I'll check your videos later. For now, please, if you have questions regarding medical school, regarding YouTube, regarding what else, life in general, you can leave it in the comment section, and I'll get back to it. So, what was I saying? I was saying something now. I forgot. What was I saying, guys? Can you remember what I was saying? The issue with life, bar, is that you can't control a lot of things. So if you get distracted, like you have gotten distracted, so you gaining back your thoughts. Please, if you are following and you can remember what I was saying, please leave it in the comment section. So yeah, okay, I know I was talking about pharmacology, right? Yeah. So basically, I was saying that okay, yes, I think it's coming now. So for antibiotics, you have to talk about microbial resistance. How do this? So if you're talking about you just have to include microbial resistance somewhere and talk about it. Especially for what is your go-to? Okay, Enixar 696 is antibiotic antimicrobial resistance. What is your go-to resource once you don't understand a topic in histopathology? Okay, thank you so much, Enixar. I really appreciate your presence here. um Please also help me share this live. Thank you. So I'm going to answer your questions, Enixar. I really appreciate you sending in your questions. So for you have to also talk about antibiotic resistance, microbial resistance to in the outline for antibiotics. Then if you're talking about I think is this CNS drugs? Yes, CNS. When you come to CNS drugs, especially when you're talking about monoamine oxidase inhibitors and all of that, which is under antidepressant, if I'm not mistaken, you would also have to talk about drug-drug interactions. So basically, any drug that has a drug-drug interaction, you include it there. You say drug-drug interactions. And most drug, if a drug is either is metabolized by cytochrome P450, most of them will have a drug-drug interaction because the inducers will be able to induce that enzyme and the inhibitors will be able to inhibit that. So if you think about it, but once a drug is metabolized by cytochrome P450, there's definitely going to be drug-drug interaction, right? Maybe with inducers and with inhibitors. So if you know that a drug has a drug-drug interaction, please talk about it too. Talk about it because that also, like, talk about the interaction that the drug have with drug, or if they say drug food interaction, because I know in monoamine oxidase inhibitors there is a drug food interaction. You don't take those drugs with cheese containing or thiamine containing food. So those are key things, right? Yeah. Then what is your go-to resource once you don't understand the topic in histopathology? Thank you, Enixa. Some of my go-to resources, number one, like, it depends, sir. It depends. If it's general histopathology or if it's systemic. So if it's general histopathology, we have pathology in a nutshell. That is Dr. Ben James' video. He's a consultant in my school. So I watch his videos. His videos are really good. He does beautiful videos. This is like a shout out. Thank you so much for joining my live. If you have questions concerning life, medical school, or whatever it is, please leave it in the chat box below and I will be sure to get back to you. Thank you all for joining my live. So yes, so pathology in a nutshell is the name of the channel. Dr. Ben James, he's a consultant pathologist and his general pathology videos are really good. He has been doing a lot of general pathology on his channel. They're really good. So I watch his videos first, right? Then there's also for systemic pathoma. I don't know if you know Dr. Husseini Sattar. Yes, but he does pathoma videos. These are like US type videos. I know people watch these videos when preparing for STEP, right? But medicine is general, whether you're a US or UK or whatever, medicine is medicine, right? So I know I watch his video. I binge watch Dr. Husseini Sattar. That is pathoma videos. He has a book. I think I even got the book self. He has a hard copy book and he has video lecture. So I watch his video lecture, especially for general. His video lecture kind of gives you his video lecture kind of gives you kind of an understanding, an overview, right? So watching his video will prime your mind, right? He tries to explain it in the simplest of terms. So I know I watched his video. The another one is I love pathology. I love pathology is really good. I like how it's explained. I love pathology is on here on YouTube. He does great work at explaining. Then there is also one more video resource, but that's more of like morphology, morphology, most likely morphology and pathogenesis on here on YouTube. So these are like some of my key resources. There's also Dr. Gibran, but I stopped watching Dr. Gibran because his videos were really long, and yeah, but Dr. Gibran Ahmed videos too are also good. You can check that out if it's something that you want. So I think I've listed some of the resources. Like I said, it depends on if my concerns are with general histopath or with systemic. So if it's general histopath, I'm watching videos like pathology in a nutshell. I love pathology too. I'm watching pathoma. Pathoma is actually good for both general and systemic, to be honest with you. If you want to have an okay, hello, it's Ali S1NC2 from India. Welcome. Thank you so much for joining my live. I really appreciate you being on here. If you have any questions for me concerning medical school or lifestyle or YouTube, please leave it down in the comment section down below. Enixar696, I hope I've been able to answer your question as to my go-to resource. So for me, I hope I've been able to answer your question. Enixar696, yeah. So I'm more of a visual person. So I like to see. I learn by seeing. I'm a visual auditory learner because I've realized that okay, like for pharmacology now, I discovered some what do you call it, some Spotify. I discovered some podcasts for pharmacology, something about coffee. I've forgotten what the podcast is called. So from there I discovered that I'm also an auditory learner. So I'm a visual auditory learner. So I learn by hearing and also by seeing. So I like to watch videos. If there are no videos, there are podcasts. Podcast too is a key thing. Maybe if I find the name of the podcast, I can't remember what the name of the podcast is. But I know there was a podcast I was listening to for pharmacology. It was made for medical. I know it usually starts with this is a podcast made for medical students by medical students. Something coffee. I've forgotten. Is it coffee or coffee time? I've forgotten what it was called. Right. But like that showed me that I'm also an auditory learner. So if you have any more questions, thank you. Okay, yes, sir. Enixar. Okay, I'm glad I was able to answer your questions in real time. If you have any more questions, please leave it down. I'm going to be here for a long time. Well, okay, it's Ali S1N6. You says, I want to join medical school, but it's very tough in my country to get into medical school. We need to clear national level pre-medical entrance test based on physics, chemistry, and biology, and no need. Okay, yes. Yeah, to be honest, Ali, I've been following a medical YouTuber, so I kind of understand from your country. I don't know if you know Ali Abdal. Do you know not Ali Abdal? Um, what is his name? Is it Prakash? Is it Prakash or Ali Prakash? I've forgotten his name. He used to do this. He's a popular YouTuber. I don't know. Okay, you're sending emojis. I really cannot remember his name. He's a oh god, I don't know why I've forgotten this man's name. He, I've forgotten his name, honestly. There's an A and there's a P somewhere. Like I know he does this. I want to do MB, but it's very tough to get into. Um how tough? I know like he does medical videos. Okay, and his friend, I know he has a friend, Abhijit. Is it Abhijit? I know I can remember the name of the friend's channel, Abhijit's Archive, but I can't remember his own channel, and his own channel is the bigger one because I know like he does different level of PBS study videos and all of that. I don't know why I can't remember his name. Is it Anush Prakash or something like that? So yeah, I understand. I understand how difficult it is, but like, to be honest with you, like if it is something that you really want to, please go for it. please go for it, like ruthlessly go for it. If it's something that you, like I said, you really want to, like, be ready to put in the work, be ready to, even if it will take you hours and hours of studying, hours of hours, because you really want this, please give it your all. Because I mean, how would you, well, if you can fund the dream, in fact, even funding shouldn't even be something to stop you from continuing or going to school, right? Like, but if you can, if it's something that you really want to do, please, please, please go for it. Like, I know it's quite tough, right? But if you can, go for it so that you won't end up like regretting not trying and asking yourself what if, what if, what if, what if. So basically, give it a shot. Give it a shot if it's possible. Um, that's the only words of encouragement I would have, right? I know how tough it can be. Or like if you can afford to go to other countries, that's also an option, I guess. Well, I know that it's not everybody that can afford that, and all of that. So yeah, that's the encouragement I'll give you. So if you have any question, please leave it in the chat box. It's Ali S1N6U. I hope I've been able to, just give you some words of encouragement. If you have any question concerning medical school, lifestyle, and YouTube, you can leave it in the chat box and I'll get back to it. I've been enjoying this life. Oh, thanks to Anixar, it's Ali S1 N6U, Adams Paul, KS9YD. Those are people who kept on sending me questions, and I really appreciate each and every one of them. Okay, I'm still here, guys. So if you have any more questions, please send and I would respond. Okay, NEET exam consists of 3 sections: physics, chemistry, biology. Very tricky and tough questions of physics, um, mechanics, electrostatic dynamics. Every year, 3.5 million people sat in this exam, and below 1% success rates. This is really bad. This is really bad. But if you keep going with statistics, you'll be discouraged, because there's also a probability that you might be among the 1% success stories. Like, we are always quick to think from the negative aspect that, okay, I most likely won't get this, and since the chance of passing is very slim, then, but what if you are one of the 1%, right, that are going to actually get it? Have you thought about it from this angle? Because I know how discouraging statistics can be. You might be one of the 1%. Like, you have to be ruthless enough to believe in yourself. Or some people say just be a bit delusional to believe in yourself. Be delusional to believe that, okay, maybe you can actually do this. Like, I really don't know how everything works in your country, but this is just my own 2 cents. Okay, thank you, bro. Thank you, Ali, for joining my live. Thank you for sticking, and thank you for sharing your experience with me. I would like for us to also continue this conversation. This 1% are those who are very good in maths, physics, and chemistry, right? I understand, but there's also probability that you can also become good in these courses, right? You can also become good in these courses now. I feel like nobody, okay, would argue that, oh, some people are born geniuses, some people with by genetics and all of that. But at the same time, I beg to disagree. There are some of us that actually learned these things. Are you a medical student, by the way? Yeah, I'm currently I'm a medical student. I'm a medical student studying in Nigeria. So yeah. So feel free to send in your question concerning medical school, lifestyle, and medical school lifestyle and YouTube. I'm here to respond to all of this because I know that I've been able to experience all of this. So in fact, lifestyle, why am I even mentioning lifestyle? Like, well, anyway, just you can ask me anything and I'm here to answer your questions. Do you guys like it with my glasses on or without? How do you get into it's Alice asking, how do you get into medical school? Is there a similar test to get into it? Yeah, for us here in Nigeria, there are a couple of tests you write to get into medical school. You would have to take WAEC, which is your West African Senior School certificate examination, or you take NECO. There's also an option for NECO, which is the National Examination Council of Nigeria. So you take these two, because these two bodies are. So if you have any questions, please leave it in the chat box and I would get to it. Thank you. So these two boards are like the governing um councils that kind of, you know, and for us, you go into medical school straight from high school. So once you're done with high school, you take these exams, O-level exams, right? Once you take these exams, you also take the joint. That is, if you want to study in Nigeria, you would have to take the Joint Admission Matriculation Board exam. So once you take this examination, you'll be given a score. So depending on how high you score, right, it plays a role in your admission process. So most of the times, the higher scores that you get, the more your chances of getting in, right? Then with the both results that you've gotten from your O level as well as your joint admission matriculation board, which is JAM. So from these two, you would submit it, right, on the JAM website to your school, because you get options of picking the schools that you want to go to. Your first choice is usually your defining choice. The other ones, no school would want to be second choice or third choice, to be honest with you. So we just fill in whatever I want to fill in there. Then from there, some schools will require you, some universities will require you to come on and write some post JAM UTME exams, like more like an entrance exam for the school. Then you go and you write that. I know for my first attempt, right? Like I got into medical school on my second attempt, because I know in my first attempt, my first school mandated me to come over and write this exam, which I did and I passed. But now, depending on the amount the school would want to take into their medical school program, they would now decide on how these people would be taken, right? So sometimes the spots are quite limited. The spots are quite limited. A lot of people are applying to medicine, but the spots are very, very limited. That's why you see a lot of people are like going through connection routes of connection, because most of the times, like if you have people in power, or if you have people who are like in like relations who are in school, they can actually get your name there, to be honest, which is the sad reality. So you see cases where people who even score high are not even getting this admission, right? But framework of how the process into medical school works here in Nigeria. So it's Ali. I hope I've been able to answer your question. I hope I've been able to answer your question. But that is just a brief overall framework of how it works. The other routes, right? There's the direct entry route. There's the um there's the A level. You can go through A level programs. Yeah, to get in. But yeah, that's it. Okay, great. I'm glad I could answer your question. Please, if you have any more questions, but here it's all about clearing next NEET exam, which is 3 hours. If you're able to clear it, then okay. Otherwise, you'll fail. No other way to get into medical. Very high competition. Mm, I understand. I understand. It's quite sad. It's quite sad that there's only one route, and the fact that the competition rate is really high. But I understand that medicine in every, I don't know, medicine in every country. I don't know for every country, but I'll speak for my country. Medicine in almost every place is actually competitive, because many people want to be doctors, right? Many people want to be doctors, so it's, I know it's quite competitive everywhere. Well, now you're saying that this is the only route to actually like get into this. I can understand the level of competition. Thank you so much, Ali. You have enlightened me a lot on the Indian medical system. I think this is quite new and fresh. This is something different. Thank you for joining my live, Ali. Please make sure to share my live. Thank you. Make sure to like, like this live and share it. If you have any more questions for me, please send it to me and I would answer. Yes, brother, much more competitive than engineering entrance test. Wow, that's really crazy. That's crazy. Yeah, but I would agree. Most people, like I said, that most people want to be doctors. So I understand how the whole entrance process is. Um, please send in your questions. Send in your questions. Um, I'll be here for some minutes, right? I was expecting to get more questions, but it's as if most people, I don't know, they didn't just send it. Okay, yeah, I'll just be answering questions based off what some people asked. I know some people did ask for chemical pathology. So like how the whole structure works and everything. So when it comes to chemical pathology, now we know that chemical pathology is the study of the deviation, abnormal deviation from normal, right? In terms of um basically the body's chemistry. Where we're talking about metabolic derangement, we're talking about things like electrolyte derangement and all of that. So a lot of like me, I did struggle with chemical pathology because like it is very, it's cuts across different fields. It is not niched, it's not focused to one thing. Because some point we are doing geriatrics medicine, next we are doing pediatrics medicine, next we are doing like something totally off. So like it was very, it cuts across everything, right? So one advice I would usually give, right? I don't know how it works for other schools, but for our school, is a test of understanding. You cannot cram to pass their exams. You really have to have understood the concept because sometimes they will give you like a clinical case scenario, right, for you to work up, right? So if you didn't understand the core concept, you would struggle. You would struggle a whole lot. You struggle to come to a conclusion as to what the answer is because, like I said, it is more of a test of understanding. It's not even a test of how much you've read. It's more of like, did you understand what you read? So like having understanding of this concept, then go online and ask ChatGPT. To be honest, I did mention this earlier, but ChatGPT is your best friend. Oh. As long as you're in the Gen Z era, you and ChatGPT should be like this. Like education has been made easier for us because AI chat using AIs, right, is one of the most beautiful things that have happened in our own generation because you can go to AI now and type explain this thing in the basic of terms, explain this thing to a 5 year old, and it will explain it, and before you know it, you are cleared on concepts, right? So what even brought me up to this talk is using ChatGPT. Like sometimes I go on ChatGPT and I do type things like explain, I want questions, like generate questions related to this topic, generate question related to neonatal jaundice, PLAB, USMLE standard. So you see questions that are generated associated with this topic, and you know USMLE is the US exam and PLAB or UKMLA is the UK exam. So it will generate using this format and you'll be able to test yourself and test your knowledge. So if you keep doing that for every topic, you'll be exposed to the length, the breadth, the width of this topic. So there will be no question that will be too difficult for you to answer, right? So basically, that is one of the ways that I, you know, yes, it's Ali. I can remember his name now. His name is Anuj, Anuj Pachel. Anuj Patel. He's a doctor now. He's on YouTube here. I've been watching his content and he does beautiful work. I don't know if you know him, like off YouTube. He's a medical student. He's a medical doctor now. Sorry, I followed him when he was a student. Yeah, back to what I was saying. So, like, if you have understanding of these things, like you keep testing yourself, like after every topic, whether it's on neonatal jaundice, whether it's on electrolyte disturbance, hypocalcemia, hyperkalemia, and all of that, right? So for a chemical pathologist, what they are interested in is usually the metabolic feature, like in terms of the biochemical features, like what is deranged in this condition, right? So is there hyperkalemia, is there hypocalcemia in this condition? Like what are the metabolites that are there? What are the electrolytes that are deranged? What are the how does this condition affect pH? Like they want you to itemize what is the range as well as in brackets some of the values because they're also interested in the values. Like okay, when you say hyperkalemia or when you say hypocalcemia, at what levels is it less than this? What is the amount in terms of milli equivalent per liter? So they want you to know some of these 10 standard things, right? You'd impress them. But typically for chemical pathology, you follow the normal physiology essay of okay, Anush Pasha, I know very well. He's a very intelligent guy. He was among the yes, neat topper. Yeah, I've actually been following Anuj. I love Anuj. Like I've been following his content and all of that. So I was really happy when I saw that he was officially now a doctor and all of that. So he exposed me to a bit of Indian medical system. And I love your teachers, honestly. I love your teacher. It's just that I couldn't afford some of you guys teaching what do you call it, teaching softwares, our applications, because I know it was quite expensive, but I know there were some teaching applications. I'm a subscriber. Oh, that's nice. But bro, Indian medical schools are very good and advanced, like AIMS, All India Institute of Medical Science. People who get top rank in the NEET exam, like I mentioned, that are 1%. So 1% of that 1% get into AIMS. Oh, that's nice. Yeah, and Nixa, Indian teachers are damn good. I'm an advocate. Please, if you have any questions, leave it in the chat box below and I would get back to it. I'm an advocate of, I don't care what people say, because a lot of people will say, oh, Indian teachers are not good, or like they have one side, they say that their teaching is very adulterated with their accent. I love it too. I love Indian teachers. I feel like they they are the ones that break down things to the basics of things. Like they are a system that me I know I can relate to. So I do, even most of my books are Indian books and all of that. So back to what I was saying. So once you understand this chemical pathology, once you understand the biochemical features, because biochemical features usually takes more marks, to be honest, in chemical pathology. Biochemical features takes more marks. Then there are other things they want you to write on, like introduction, definition, classification, maybe if there's clinical features, what are the clinical features? Like if you're talking about Cushing, they want to see as well as they want to see clinical features as well as what do you call those ones? Clinical features as well as biochemical features. Those are some of the key things that they would want to see. Hello, I'm Ria from India. Where are you from? I'm from Nigeria. Thank you, Ria, for joining my live. Please do make sure to hit the like button as well as the subscribe. Welcome. So basically, once you have understanding of that, um please, if you have a question, leave it in the chat box. You used to discuss different medical cases in form of, yeah, Ali, like he does beautiful work. Like he's somebody that I also watch and he's really really good. um Guys, give me a moment, I'll be back. Hey, can you see me? Hello. Okay. Okay, realizing, what advice would you like to give to teens? I would say enjoy your teenhood. To be honest with you, like times are changing, right? In as much as the more you grow, the more you realize what is important and what is not. You tend to understand that things are, I don't know how to put it, like you tend to realize there are more things that are more significance to you as you age, right? But I'll just say, I used to say that if as a child, enjoy your childhood. Like if you're 18, enjoy it. You will not be there forever, right? Explore, try and grow, try and learn and all of that, right? While you still can. So that's the advice I would give. Like enjoy yourself while you're 18. Don't give your parents problems, right? Because you tend to understand that they do what it is, like that was what they thought was best for you. So guys, I'm so sorry I had to leave the live because I don't know, the network was giving me warnings, right? Hi, welcome. I'm sorry I had to quietly like leave the live. Thank you so much. Please like if you have any question regarding medical school or YouTube or even lifestyle in general, please leave it in the chat box and I would get to it. I really have to just say hello in, let me shout out your name. Thank you so much for joining the live. I really appreciate. I just had to take a quick break off. Okay. Okay. Thank you for joining my live. If you have any questions concerning lifestyle, YouTube, and medical school, you can leave it in the chat box and I'll get back to it. So basically you understand that your parents actually did what they thought was right, to be honest with you. So don't punish them too much. Be kind to yourself. Just be kind to yourself and allow yourself to enjoy your childhood too. So that's the advice I would like to give to teens, right? It's good, even at that age, you can become focused. You can know what it is that you want, right? And don't stop. Like, keep fighting for it. Like, put in put in effort and be realistic with yourself, because that's another thing. Sometimes we like to live in delusion. Like, be realistic with yourself. Honestly, be realistic with yourself. Thank you so much for joining the live. If you have a question concerning life, YouTube, and medical school, leave a comment in the chat box and I will get back to it. It's Ali. Are you here? Enixar, are you here? Ria, are you still here? Because it looks like after the disconnect, I don't know, most people left the live. Okay, so I was talking about chemical pathology and how chemical pathology, that is basically how chemical pathology works. So I've spoken about histopathology channels. I've talked a bit of pharmacology and a bit of chemical pathology. So maybe I'll talk about microbiology. For my school, I didn't really like how. If you have any questions, please drop it in the comments, the chat box, and I will get to it. For me, I really didn't like how microbiology was taught. Not like I don't like the teachers, though. I love the teachers. Especially for parasitology. Dr. Daha was one of the best. Then immunology, we had Prof. Okolo. Then virology, they were like we had Prof. Banwat, we had Dr. Cosmos. These are people who were very enthusiastic about teaching, right? But the issue I had was with the structure, right? I feel like for microbiology is best learned with in blocks, right? Or should I say in subsystems. So I think for microbiology it's best you learn virology first, then you learn parasitology first, then you learn bacteriology first. But on coming to this class, we're being bombarded. We're bombarded with virology, parasitology, bacteriology. Today they will teach you virology, tomorrow is parasitology, next tomorrow. Like, it was scattered. So it took a lot of time. It was during our blog posting that it was now divided into these different blogs. And okay, this is how you should learn it, mycology and immunology together, then this and this together, and then this and this together. That was much helpful, right? Breaking it down, then from there, microbiology is a visual course, so I would say that you should try as much as you can to use as much video resource. For microbiology, some of the video resources that I use that I don't regret is Sketchy. I know Sketchy microbiology is really good. I know Pixorize too is good. I didn't really use Pixorize, but I know Pixorize is good. I think they have a channel here on YouTube and all of that. Then which other one is good? Then depending, right? Kaplan Immunology. I watched Kaplan Immunology and it was really good. Then for parasitology, we have Med Zukruf. Yes, Med Zukruf is on YouTube here. She has videos for parasitology, virology. She has videos for, no, she doesn't have for virology now I think about it, but she has for parasitology, she has for bacteriology, right? Then there was also this channel. I've forgotten the name of the channel, but it had good videos for mycology. The issue I had with him was he wasn't loud. That was my issue. But I had good videos for mycology. Then I know that for virology, I struggled a bit, but you can try Kaplan videos for virology. His videos are good, as well as Sketchy. Sketchy is also good, right? Because they try and create a story around these microorganisms so that you don't forget them. So, yeah, those are some of the things that help me. So, Ria, thank you so much for joining. Yeah, I answered your question, Ria. What advice would you like to give to the teens? I did answer your question, and I said that you should enjoy your childhood. Like, enjoy your teens, enjoy it. If you can have focused plans, please, if you have dreams, please go for it. At this point, be kind to yourself, be kind to your parents. To be honest, be kind to yourself and be kind to your parents, because your parents are, they virtually did what they think was best for you, right? So be kind, and also be kind to yourself. I think for in your teens, what you should come into is more of self-awareness. Be confident in your own skin, be confident in your own beauty, be confident in the grace that you carry. I'm a very religious person, so I would say also getting to know God for yourself too would be good. Then, you know, if you have dreams, like have huge dreams and arrogantly go for it, right? Be interested in learning about finance too, because you'll be the one in charge of your own finance now. So be interested in learning about finance, be interested in growing, right? And don't put too much pressure on yourself. Live a life of contentment. Be more content with yourself and understand your limits, understand how far you can go, and basically you would be fine. Okay. If you have any question, please leave it in the chat box. Don't forget to like this live, like this live, like this live, like this live. It's Ali. Are you back? And Ria, thank you for coming back to my life. Um, please just say something in the chat box, like hello, whatever, so that I can, shout out your name. I'm studying a professional course, and most of my friends are enjoying and chilling, and I'm sitting in the room with books. It's the sad reality of life. It comes with it, but don't think about short term, right? Think about long term, right? Temporarily it might look like suffering, but long term, like, would it pay off? Like, once you can answer this question, like, why are you doing this, would it pay off in the long run? To question that I'm doing this because of this, and I'm definitely sure that it's going to pay off in the long run, then go for it. Like, it's fine. That's why I say you should be more content with yourself, enjoy your own skin, enjoy your own company, right? And yes, maybe you have a test coming up or something, or you just realize that you have to study. Please study. There's fear of missing out, there's FOMO, but also try as much as you can to also socialize with your friends too, because you go to school to also build this connection, right? It's not just it's not just it's not just the head knowledge. There's also the connections, the friendship that you build. So also make out time to also socialize with your friends, and all of that. But don't beat yourself up if you're studying. There's no need. So, thank you so much for joining my live. If you have questions or concern, please leave it in the chat box, and I will be sure to get to it. Thank you so much, Ria. I hope I've been able to answer your questions. It's as if it's only Ria that is asking a lot of questions on this live. Please leave questions in the chat box. Lifestyle, YouTube, medical school, and I'll be sure to answer it. So Ria has sent another question. I compare myself with others. What should I do? And one more thing, I can't maintain consistency in the gym and study sometimes, as well as what should I do? So first off, why are you comparing yourself with others? Like, um that's why I'm saying that you should actually enjoy your own skin. You should actually enjoy your own self. You should actually be content with your own pace, right? Sometimes when we compare ourselves with others, we are doing so because we are seeing things that maybe we want for ourselves or wish for ourselves. So instead of spending time, I feel like comparison is a thief of joy. Yeah, comparison is a thief of joy, right? Because if you keep comparing yourself with others, you will never celebrate your small wins. You never celebrate yourself, right? It's every time it's going to be a constant battle, and you will not acknowledge the little growth that you're making. So I would say, like, sit back and ask yourself, like, why exactly am I comparing myself with others? What is it that they have? And yeah, then one more thing, I can't maintain consistency in gym and studies sometimes. Consistency is always an issue, but you can set up plans. You can put in structures that can help, you know build your consistency. Like, for example, you can get yourself a gym body. To be honest, I'm not a gym person, which is bad. Go to the gym. If you can afford the gym, go to the gym. Just make sure you exercise and all of that. It's actually good for your health. It's good for your heart, right? So back to what I'm saying. What was I saying? Yeah, you can put in structures. Thank you so much for joining my live. If you have questions concerning lifestyle, YouTube, and medical school, leave it in the chat box and I'll get back to it. I'm currently answering Ria's question now. So, like, you can get yourself a gym body. A gym body can help you, you know, because whenever you're not feeling like going, the person might want to go and you guys can go together. Then basically structure, right? Try and reduce the inertia to do some of these things and you see yourself doing them. So what are your thoughts on making money in med school? Is it just a distraction or is it necessary? If you can, me, I'm an advocate of whether or not you're doing like some people, right? If you can balance it, it's fine, it's very fine, right? There's some people that can't balance these things, like they can't balance med school and business, and that is fine. I hate when people judge them because they can't balance these things, and I'm like, people are different. Because you can balance, you can balance med school, business, sports, politics, right? Good for you, but not everybody is like that. So this question boils down to yourself. It boils down to, yes, Ria, you can ask me more questions. So this, I'm currently answering Joshua Okohoyi Fioda 1872. I hope I pronounced your name right? I'm currently answering your questions now. So like I'm saying, like it boils down to you as a person. If you know you can balance making money in school as well as med school, please go ahead and do it. I've seen people, like one of my classmates, like even in our in our 300 level, that is our MB, our first professional exam. She's a business owner, like she sells shoes, and she ended up having a distinction in anatomy, right? She did business, I didn't do business, right? But I didn't get that distinction, right? But her, she did business and she also did school and she was still able to get a distinction. So basically, what I'm just trying to say is that for her, she was able to hone down and know that, okay, this is how med school work. It's looking like something I can balance alongside my business. So why don't I try this? And what is more of a priority to me? Thank you so much for joining my live. If you have questions, leave it in the chat box and I would get to it. Ria, feel free to ask as much questions as you want. So like if you see that you can balance it, please go on, do your business, make your money. I feel like making money is even important, to be honest with you. um I think making money is important. That's why I'm trying to even monetize my YouTube, because subsequently I'll be doing more live streams, silent live streams, right? In just all in an attempt to, monetize my YouTube eventually. So basically making money in med school is very important too. But if it's going to be at the detriment of your studies, please leave it. Like, please leave it, because you have to decide what is important to you, right? And I'm sure that med school is more important than this. So, like if you see like the business side is trying to, take over the med school side, then you can put it on a pause, right? Then when you're more settled, you can come back to it. It's just finding balance. It's just finding balance. So you're asking if it's, like I said, distraction, it depends on you. Is it necessary? It also depends on you, right? But like I would say, if you can afford, if you can fund med school and all of that, so it's fine. Ria is asking more deeper question. Does manifestation really work? Um, for me, I understand that there's power in the tongue, right? I'm a very religious person, like I said. Joshua, I hope I've been able to answer your question. Yeah, let me just be sure I've answered this question before I answer the next one. Joshua, I hope I've been able to answer your question. So for Ria, yes, I'm a very spiritual person, so I believe in the Bible. I believe in Jesus. I'm a Christian, right? And I know there's power in the tongue. So I also believe in in words of affirmation. Yes, thank you. You have. Okay. If you have any more questions, Joshua, please type it in the chat box. So I also believe in like words of affirmation and basically saying positive things over yourself, right? So if that is what you consider manifestation, fine. But I don't believe in, yeah, saying positive things and speaking basically over your life. I think that's a good thing. So you saying that, I would say, yeah, it's kind of worse, because I noticed that once you say positive things over yourself, you pray positive things over yourself, like, I don't know, things just start aligning. I don't know, but you get to see. That's why some of the times when I'm going through a lot of things, I try to stay positive and say positive things, because I notice I don't really know the mystery behind it, but like if you stay positive, like I don't know, positive things just come to you, right? So, and to some extent, I do, to some extent. If you have any question, please type it in the chat box concerning med school, life, and YouTube. I've really been enjoying this live, guys. Please don't forget to like and subscribe so that I can see more of me and my content. It's getting quite late over here, and I don't have my lights on. I'm chipping some simple hacks for pharmacology, like these two things that do matter. Okay, so I started my life talking about pharmacology, but I would still like reiterate Joshua. I'll still reiterate. So I'm saying like for pharmacology, I went over like what is expected. In my subsequent videos, you're going to see it. And I said for pharmacology, I'm more of an audio visual learner, so I learned by watching videos. So for me, some of the things that helped me in pharmacology was watching a lot of videos, right? I will not even say that my class lectures were enough for me, right? So I watched a lot of YouTube videos, whether it's speed pharmacology, then Dr. Rajan Pantel's video, iconic. His videos are iconic, one of the best in the games, right? So that you don't find his videos like that on YouTube. But Dr. Rajan Pantel, I kept calling Rajiv in the video I'm going to use, but it's actually Dr. Rajan Pantel. Like his videos were very good. So watching videos for me, even listening to podcasts, I can't remember the name of the podcast, but the podcast usually starts with this is a podcast made by medical students for medical students. I forgot whether it was coffee something or something like that. I can't remember what it was called. But listening to those podcasts also helped me. So, like I said, I'm a visual learner, so I like to watch these things and I like to hear too. So, watching and hearing helped me. Then I didn't do flashcards. I know flashcard works for people. I know one of my classmates, shout out to you, Milka. I don't know if she's watching this live, but she did flashcards. That girl, she has flashcards for almost everything, which was beautiful, and that was what worked for her. For me, it didn't really. I wasn't an advocate of that. One of the key things that worked for me was, answering past questions worked for me like a lot. When I say past question, I don't mean only questions that are related to my school. So what I used to do is I go online, right? Especially pre-test. There was a book called Pre-Test Pharmacology. It's for USMLE. That book, the questions in that book are difficult, but like it prompted me and pushed me, right? Because whenever I answer question in pre-test pharmacology, like um, whenever I answer questions in pre-test pharmacology, like it helps. I don't know, there's a depth that it brings and the thought that you have answered the most difficult question. So whenever I make mistakes, so for me, pre-test pharmacology help. Pass medicine also is a UK medical school question bank, so I know I answered that. So like basically for me, pharmacology, what really helped me is filling questions, right, and going through the corrections, because whenever I fill a question, I go through the correction, I never forget. Then I repeat. Repetition, pharmacology repetition is key. Teach yourself, teach your friends, teach your dog, teach your cat, teach anything, right? Just keep on saying these drugs over and over and over and over and over again. Teach your friends because they will help correct you, honestly. Then you can teach whatever you want to teach. If you like, teach a doll or teddy bear or whatever. So basically, repetition for pharmacology is key. Then I know that some people use Anki, yeah, the flashcard app. For me, I didn't use I used Anki, but like not necessarily for pharmacology. I wasn't consistent. But if you can try it out, if it works for you, fine, right? So yeah, these are some of the hacks that actually works for pharmacology. I'll be releasing a longer video on my channel, right? But I know I did ramble in that video a bit, but like I'm sure you will find it helpful too. I hope I was able to answer your question, Joshua. Can you speak English in an Indian accent? Ria, I can't. I don't think I don't have an Indian accent. I can't speak in an Indian accent, to be honest. Yeah, I can't speak in an Indian accent. I've not really tried it before, but I know I don't have an Indian accent, right? And I'm not Maraji that can copy accents. My Nigerian brothers will know. She can speak in different accents, and it's beautiful to see. Okay, it's all right. Okay, Ria. Thank you for joining. I'm Joshua. I hope I've been able to answer your question concerning pharmacology. If you have any more questions, please leave it in the chat box and I will get to it. Okay. I will be rounding up in the next roughly roughly 5 to 10 minutes. So I'm open for your questions. Hopefully the life doesn't even end by itself. Okay, I'm glad I've been able to answer your question, Joshua. If you have any more questions, please. If you have any more questions, please type it in the chat box and I will get back to it. The session is coming to an end soon. I just got admission. So this is from Football Talks _18. I got admission to study medicine and surgery this year. Please, what advice do you have for me? So for congratulations. I'll start off by saying congratulations. You're welcome to this noble profession, right? The advice I would have for you is to enjoy every class, right? I know it's very easy to be carried away with the thought of graduating, because now you'll be excited to enter and all of that, but the next time you just find that you're overwhelmed, or like your thought process is now channeled towards graduating. Let me just graduate. Please enjoy every class. Try and understand what is the have aims for each and every class that you experience. If you're starting with 100 level, right, there are things that are expected of you to know in 100 level. Please do your best, right? There are many people who are looking for this position and they were unable to get it. So see yourself as privileged, as honored to actually do this, right? Then um do the learning, do the work, because a lot of people will try and find ways like cheat their way and all of that. But please, if you want to be a good doctor, always put it in your head that you're training to be a good physician and people are going to actually count on you, right, to make a difference, to touch their lives, right? So whatever you do, just um please study, and just please commit. Putting in the work should be your number one priority, right? To learn these things, because one day you're going to be face to face with patients and you would have to help them, you get. So everything is a build up. Another advice I would give you is that please enjoy school. Try different things, try politics, try leadership roles, go for conferences, chat with people, meet people, grow your CV, participate in different things and get certifications. Grow grow like I feel like most medical students, they forget that life is not only about life is not only about med school. There are other aspects to life, right? So please, and I think going forward, especially if you're going to be applying to maybe for international opportunities and all of that, they would want you to show them that you didn't only do med school, like your life was not only centered on med school. Because I remember that when I was applying for certain international opportunities, like certain leadership opportunities and what gave me an edge sometimes is having this YouTube channel, to be honest. Because once I just say, okay, I was able to also explore social media and have an understanding of the inner workings via my YouTube channel. Like, they are usually interested and, okay, wow, so it means that you have other skills apart from medical school. So yes, get skills. If you have opportunity to learn photography, you have an opportunity to learn something, please learn it, right? Try and be more versatile. That is one thing that I would have done, or I did try to do. Get certificate, write essays, join competitions, improve yourself. It will help you now and also in the long run when it's time for you to present, like, maybe these opportunities that you have engaged in order as to get bigger ones. Sometimes they would want to ask you, have you held any leadership position? What other skills have you been able to acquire? So all of these things would come into play, right? So I would say, this is my advice to you, right? Take hold of opportunities that you get in your medical school. Like, take hold of every opportunity and grow academically, grow in other aspects of your life. Let it not only be academics that you're growing, right? Also grow in your spirituality too. If you're a spiritual person and you love God, please grow with him, right? So basically, explore. That's one thing I would say, right? And there are also scholarship opportunities that I know they are open here in Nigeria to people, right? Please, if you can apply for this scholarship, please apply for this scholarship opportunities. It would really, 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 really help you a lot. Okay, I think this is better. I turned on the lights because it was getting quite dark. So like please apply for these opportunities and just grow. But this is the advice I would give you, right? Enjoy each class as it comes, right? Take it. Well, you're welcome, Football Talks. I really look forward to talking more with you. Don't forget to like this live and hit the subscribe button. Okay, Ria says, I hope I've been able to answer your question, Football Talks _18. I miss my best friend and I can't forget him. I had tried to communicate, but it didn't work. What happened between you and your best friend? You got separated or something? Okay, Football Talks. I'm glad I was able to answer your question. I would like to communicate more with you eventually. So feel free to reach out to me via my email, AnikaMD everywhere. And don't forget to subscribe and like. Okay, if we I'm just going to extend maybe 3 minutes or so. If you have any more questions, please leave it in the chat box. Because I will be rounding up for today's live session. Eventually, guys, I might go live again. I've liked this live and surprised you. Thank you so much, Football Talks _18. I really appreciate. So if you have any more questions, you can leave it in the chat box. Because I'll be logging off. So I'll be doing more silent live streams going forward on my channel, and this is all in a bid to acquire um my watch hour. However, if I'm going to be having an actual life where I want to like talk and converse face to face, I would put up flyers on my community tab. Yes, you guys engage with my community tab, engage with my videos, guys. Watch my videos, leave comments. Please watch it to the end because I know that most people are, dropping off. Okay, do we have any more questions, guys? Yeah, I hurt him, but I tried to convince him, said sorry, but he just changed and just ghosted me and the rest of friends to now. He's just like to be able to miss him. Please, for those kind of friendship, we continuously try and reach out since you were the offender, right? Time heals all wounds, right? You can't force him to forgive you. Forgiveness takes time, right? So you should understand that forgiveness takes time and it is outside your control. You can only continue to apologize and apologize, but at due time, I'm sure he will come around. Yeah. Okay. I hope I've been able to answer you, Ria. Thank you so much, Ria. Thank you, Football Talks. Thank you, Joshua. Thank you. Thank you, it's Ali. Thank you, Enixar. Um, thank you guys. Thank you so much for joining my life. Tabit123, Adams Paul, KS9YD. I don't know, you can just say something in the chat box, maybe your name or something, so that I can, shout you out. Thank you so much for joining my life. I hope I've been able to answer all your questions. Hope I've been able to address all your questions, guys. Um, I hope I've been able to answer your questions. Okay. Do we have any more questions?